Good afternoon, good evening. If I can get the NYMER slides up, please. I'm not going to be able to. I could start giving Ben's talk, but probably better that I give my own. Okay. Well, I stand here as the chairman of the MDS Foundation to welcome you to the 15th International Symposium. I'm going to give some brief remarks about the foundation, also going to introduce several of the awards that were given out and announce who's receiving these awards. The MDS Foundation began in 1994 as a non-for-profit advocacy organization that was established at the time by some of the few people in the world that were interested and expert in MDS. The MDS Foundation itself is based in Yardville, New Jersey. It's about 45 minutes outside of Philadelphia. If you're ever in Philadelphia, it's a big step up to go to Yardville. And the mission of the foundation is to educate patients and healthcare providers and to support innovative research on MDS. We've expanded our mission to include related myeloid neoplasms, MPN, AML, and to accelerate progress in diagnosing, controlling, and ultimately curing these diseases. We're going to have a birthday. This is the 25th anniversary of the MDS Foundation, and after Ben's remarks and before the reception, we will be serving birthday cake right outside. So we are really having a birthday today. I will also tell you that to support the foundation, there's a booth where you can get a picture. For those of you who are not on social media, shame on you. And for everyone else, if you post the picture to social media, Acceleron will donate money to the MDS Foundation so we can achieve our mission. We have created a series of boards that lead the MDS Foundation, a board of directors, a medical and scientific advisory board, a development board, international nurse leadership board, and the foundation is unbelievably ably run by the executive director, Tracy Araka, and she and her team have been working with the local organizers and work day and night to keep the foundation in the tip-top shape that it's in. So I want, on behalf of everyone, to thank Tracy and her staff. Just a few of the things that the foundation does. It has patient support for MDS, MPN, and soon for AML. There's Building Blocks of Hope, which is a resource for patients and caregivers. We have a mobile app, the MDS Manager. You can calculate the IPSS via an MDS Foundation mobile app. We have had a series of videos, animated MDS patient videos, and we've been developing global patient support groups and live quality of life patient and family forums. In terms of professional education, I mentioned this is our 15th International Symposium. We've also begun a series of regional symposiums, last year in Sao Paulo, Brazil, next year in Tel Aviv, and hopefully Uruguay. And we also have had symposiums at the ASH meeting. This year will be the 23rd year that the foundation has participated at ASH. We are also on social media. We have online learning centers, and we're continuing to support nurses and investigators worldwide. I'll point out on the right is the wonderful advertisement for Tel Aviv 2020, and on the bottom, Toronto in 2021. We look forward to seeing everybody at both meetings. This lists the various sites. We've had 2 in the United States. The rest have been outside the United States, mostly Europe, also in Japan. And on the upper left, you can see from the Valencia meeting, that was our last meeting, and like Kirsten said, This is a beautiful city. I had a chance last night to walk around. Great food. And of course, with the meeting will occupy almost all your time, but people do have to eat and walk and get some sun. We have a Centers of Excellence program. We have 184 designated MDS Foundation Centers of Excellence in 37 countries. We refer patients. We've helped enroll on clinical trials. And the physicians and nurses involved in the Centers of Excellence have volunteered to present at patient and professional educational events and helped us develop resources and programs. Outside of the booth, you'll see that our explanation of what your bone marrow does has been translated into 10 or 12 languages, and we thank all the investigators and the nurses who've helped to make sure that we have accurate translation of a disease as complicated as MDS. There's a process, a series of steps that need to be met in order for an institution to apply and become a Centers of Excellence. We've had a couple in China recently, and basically you need to be doing clinical trials, publishing, and have the appropriate expertise. We now, on our mobile app, you can find a Center of Excellence and learn about how to contact people within the Centers of Excellence. We've been very proud of the research that we have supported over the years, including most recently the IWGPM, which met earlier today. I believe you'll hear about some of the findings at the meeting. And we're continuing to revise the IPSS-R, including molecular and other aspects, clinical data. Now almost 3,400 patients are included, and hopefully we'll get more insight into the biology and also stratifications and treatments of patients. We have the MDS-MPN International Working Group. This has already opening a study to provide novel agents for patients with the overlap syndromes, MDS-MPN, and we're very excited about supporting collaborations among translational scientists for this. We're increasing awareness of the foundation and of the disease. We held our first ever awareness walk in Bastion in July of last year, and on June 22nd in Chicago, we will have another awareness walk. As a Chicagoan, I can tell you that by June it should be warming up enough that you could walk in Chicago. And then in Boston on September 14th, the second walk. And these are engaging a lot of patients and caregivers and the various physicians and other caregivers in the region. We've established a series of partnerships with the MDS Alliance, who's helping in terms of delivering information and optimal care for MDS patients worldwide, and also the No AML Patient Advocacy Ambassador Program, which is the first global AML awareness initiative to provide patients and families and health professionals with information that they need to deal with AML. There is not really an AML foundation per se, and so we're broadening our scope in terms of myeloid diseases. We've had a young investigator grant program that was initiated in 2005. We've distributed a bit over $250,000 so far, and this is for aged 40 years or less young investigators who are studying important aspects of MDS. In 2017 at Valencia, we presented David Salmon and Yoshihiro Hayashi with these awards. And at this meeting, we're very privileged to present Sue Park and Daiichi Inoue. Sue is, they're both at the meeting. Sue is at UCSD and Daiichi is at Kobe City, Japan. And they will be presenting talks on Saturday about their research. We are also going to be giving out the Tito Bastianelli Young Investigator Award. This is a picture of the late Tito Bastianelli, and this award was established by his widow, Francesca. He was an Italian businessman who died in 2005, and in his memory, his wife has funded this program. 10,000 euro awards are given to 4 individuals this year, and they are shown here. Francesca Vinci from New York Blood Center, Isabel Hoffman from the Karolinska Institute, Eli Papi-Manuel from Memorial Sloan Kettering Cancer Center, and Zuzana Totova from the Dana-Farber Cancer Institute. And I encourage everybody, they're doing incredible work. I think before I introduce our speaker, I'd like to thank the organizers, Kirsten, Lars, and Jacob, for putting together an amazing program today. And in a moment, I'm going to ask Dr. Benjamin Ebert to come up and begin with his talk entitled The Origins and Evolution of MDS. Dr. Ebert has made some critical, important contributions to our understanding of MDS, and in fact has branched out beyond the hematology aspects to understand the role of inflammation and try to understand some of the cardiovascular events that occur in patients with clonal hematopoiesis, rather than talk incessantly about his contributions in career to date. I'm going to invite him to come up. He is at the Dana-Farber Cancer Institute, where he leads the, either called the Hematology Oncology, I'll just call it Hematology Oncology program. Ben.